Well, our next guest was one of the architects and leading advocates behind Ontario's first publicly funded fertility initiatives. She's a change maker in reproductive health and shines the light on the ongoing challenges faced by the Black community.
And she's here this morning to discuss the importance of fostering a more inclusive and compassionate provincial healthcare system. Good morning, Dr. Marjorie Dixon. It's such a pleasure to have you here with us.
Thank you for having me. My pleasure's mine.
So we head to the polls in about a day, tomorrow. Exactly.
Yeah.
And healthcare is one of the biggest issues. Yeah. But I think when we talk about healthcare, it can be such an umbrella term and not specific enough. But we know that healthcare has to be specific. So maybe you can talk about your role as a doctor and what you're seeing in the healthcare system and what kind of needs to change to be more inclusive, to include other people that are kind of disproportionately impacted by systems of, I don't know, systemic racism in the past.
It's baked into the system. So I think from my perspective, as I came into the fertility industry some greater than 20 years ago now, what I recognized is that as a physician that looked like me, it wasn't necessarily represented. My patients weren't looking like me. And it was pretty homogeneous, and patients were not getting to care in the way that was fair or equitable. And I felt like I needed to create a bridge to that disparity, because I thought about my Jamaican Canadian parents, who I was a first generation born here. If they were fertility patients, would they be able to access the care that I've been trained in this country to provide?
Right.
And that was a question I couldn't answer positively. And so it was very important for me to advocate. I became an instant patient advocate. And in this province, to make Ontario the best province in which to grow your family, in the Canadian universal healthcare system, it was important to talk about the disparity, to create a voice for it, and then to create a path forward, speaking with governments and provincialities to talk about how can we bridge that with new data, looking at different people who are culturally specific.
And so how would you say your work is going? Because obviously there's a long way to go. Are improvements being made? Are you seeing steps moving forward?
Yeah, well, you're talking about the election tomorrow. I mean, if you look at all of the platforms, the Conservatives, I want to applaud them. They committed $150 million, which is 3 times the original investment, which was made originally in 2015. And Innova Fertility, of which I founded, was part of that original rollout. And as a physician, I was a big proponent of that because it levels the playing field. And creating equitable health care and bridging that disparity, which we know exists, particularly for members of the Black community, for members of BIPOC communities, for members of the LGBTQSI+ community. Ontario is at the forefront of that. And it's very important as people go to the polls that they think about what's important, not just in the healthcare platform, but for me as a fertility provider in the fertility healthcare platform.
And when people hear the word fertility, they might get intimidated. There's maybe not too much literacy around it. Why did you decide to start Innova?
I decided to start Innova because I'm an idealist, and I believe in the universality of healthcare, and I also believe that everybody has a right to a family. And it should be regardless of your geography, of your sexual orientation, gender identity, your location within the province of Ontario. Innova has really been dedicated to making sure, as we are part of this Ontario fertility program, that all Ontarians can access it. So our growth plan as an organization and as the physician driving it is to be in multiple different jurisdictions or places in Ontario that aren't necessarily just the City of Toronto. While our main office is North York, we serve people from Northern Ontario, we serve people from Southwestern Ontario, we serve people in Halton region, we serve people all over Ontario because everybody needs to get to care. The problem right now is that there's a long wait. And so even though I applaud the governments that preceded this, that started the program, it's very important now to shorten wait lists and get more patients to care in a timely way. And that means all patients, including patients that look like me and you and everybody else in Ontario.
And also to get more doctors that look like you as well, right? Black doctors, BIPOC doctors. That's the other issue here as well, because we've even heard of the studies about how the baked-in racism, systemic racism in the system, about like if a Black patient presents with pain, that they're treated very differently than a white patient presenting with pain here. So the doctors need to have the better understanding, the foundational understanding as well, don't they?
The clinical healthcare providers need to represent the populations that they're serving. And actually, I'm going to be speaking at McMaster University to the OBGYN department today. survey about this disparity and what's important in medical education to include this cultural sensitivity so that we understand that it's not just better for patients to have physicians that look like them, but it also results in better outcomes. Because what we're understanding when we look at data that distinguishes us culturally, that we do differently. So Black patients get to care. It takes longer for them to get referred. So there are barriers in the system. Doctors will look at them and say, well, we look at Black patients, we don't think they're really infertile, so we will refer you in 2 years. Whereas a white person can advocate for themselves maybe a little bit better. They get referred sooner. Right. So we know that that happens. And actually, patients present generally 2 years later in the Black population to fertility care. So it's important for those who are doing the referring to remember that and to refer them in a timely way. Yeah. And then us as physicians, we have a responsibility to provide better fertility outcomes for all of our patients, but particularly for our Black patients. So we need to be up on the literature and to be advocates for all of our patients.
Yeah, absolutely. What an important conversation. I wish we had more time. Dr. Marjorie Dixon, really appreciate your time this morning. Thank you.
Thank you, Doctor. Good to meet you. Thank you so much. Appreciate this.
Thank you.
That's Small This Wednesday for this week. We're back with more CB24 Breakfast coming up right after this break.